Okay, we're here today for another demonstration session of consciousness-based healthcare. Today our client is from Tennessee. He has received body talk before. Just like with every client, I took the last hour to check in with my intuitive techniques and with kinesiology to get a first idea, to get information. Then I looked at the intake form that every client has to fill out. And both clients who come the first time and as well as clients who come again, I have different intake forms for them. And this helps to focus the intention for the client, and it helps also to bring the client more awareness, because everything that's going on in one's life, whether it's physical or mental, emotional, or in the life in general, is something that points to an opportunity to grow as a human being. And the intake form is in front of me right now, and my client is on the phone with me. And so, just like with every client, I want to ask him a little bit first what's going on the different aspects of life. I'm going to start out with the physical and then ask about the mental, emotional, and spiritual, and so forth. And so, I wanted to know first a little bit if you could tell me a little bit about how your physical health is, and especially if there's any pain or illnesses that's going on.
Yeah, I mean, I tore my meniscus in November in my left knee, and so not that it's like a constant pain or anything like that, but occasionally it'll swell and cause some discomfort. And other than that, just kind of like I don't know how to describe it, but sort of like a tightness or like an uncomfortable feeling kind of like around my spleen, liver kind of area.
Okay.
But other than that, nothing too dramatic.
Okay. How is your emotional life?
You know, it goes, 1 minute I'll be completely like elated in a wonderful place, and then the next I'll be completely like depressed and hopeless. Those places do come up pretty frequently as well.
What about your spirituality? How are you feeling about your spiritual life?
I feel fulfilled in it for sure. You know, it's definitely a huge part of my life. So
now I would ask more in-depth questions, but I already have the intake form and I have already checked in with him before. I'm gonna leave it at that unless there's something else you in particular want to tell me, to focus on, to work on.
I think I kind of, yeah, like I just mentioned in that form, but mostly just like lack of clarity, like motivation, energy to like do the things that I guess I should be doing. So that's just kind of where I'm at.
I would like you to go to a space where you're most comfortable, if you even want to lay down or whatever is comfortable for you. And so I'll do the same thing. I'm going to take a moment to just center myself and get ready. So the first technique that we're using here is a technique that brings more clarity, and what we're using it for is it's going to bring more clarity about this whole issue around the motivation or lack of energy. It's a very preparatory technique, and we're going to use it to see what's going on there. So that's the first thing, and then I'm drawn to the mitochondria in the liver cells, and we're looking at something there. Feels like there's a little bit of a toxicity there that affects the function and especially the ATP production of those cells. And so in parallel, while we're going to be working on the ATP production of the mitochondria, we're looking into what Bodytalk calls what's called the primary masculine aspect. What this means is that everybody who grows up internalizes a father figure and a mother figure, and we're looking into that male figure right now. The first thing I'm getting here is some of the things he has described, he internalized. And so we're focusing in this time span from about 5 years to 20 years, and we're focusing on those memories where he internalized that male aspect that has to do with that lack of energy that he's describing, or that depressive type of feeling down feelings. And we're using a technique that takes off the emotional charge of those memories so we can clear them out. And then we facilitate what psychology calls the individuation process, meaning letting go of that whole idea. If you could tap for me. And so while you're doing this, I will describe a little bit what's going on here. I'm focusing in on what I've described here in general. This is what's called the morphogenetic field. That's the information. And by my observation and my intention, we are essentially collapsing this field of information into the body-mind of the client. In this case, we're in particular using a certain form of tapping. And this tapping is simply there to facilitate this change or shift to occur. the main function how it works is because it is so widely used in the body talk system that by us using it, we are connecting to this morphogenetic field that uses it as well. Okay, you're good with the tapping and now drawn to the brain. We're gonna do a balance on what's called the singular gyrus. Okay, we need to give this a moment to shift while we're going in there. Like I said, the next thing we're gonna work on is the balance of the singular gyrus, and we're focusing here in particular on that aspect of feeling down. The things we're doing here is we're using a Parama Bodytalk technique, which is called search and retrieve, and so we are searching for those memories when there was this feelingness of feeling down and retrieving them for processing. While we're doing that, we also I also found memories that come more from what's called the collective consciousness in Jungian terms, that there's a more of a cultural understanding of certain things. And what this means here is that there's a little bit this sense of almost apathetic type of energy in the culture, maybe where he grew up in or where he was exposed to at a certain point in time. And we're helping to disassociate that effect from these cultural memories. Part of doing this, we're improving the communication between singular gyrus and what's called the pituitary gland and the third eye chakra. The next thing I'm picking up here is that resistance, there's certain resistance to change that's present, and seems to be because there's some layers in the subconscious, and he partially described the issues, but there's some layers in the subconscious that are more uncomfortable or more painful to experience, and the resistance kind of is there in order to protect from having to experience them. And so what we need to do now is we need to strengthen so to speak, the container of the client. We need to bring the client to a place where he can be more comfortable experiencing and feeling those issues that are still there, so he can then transcend them. And so I want to talk about love therapy. And the premise of love therapy is that first and foremost, love has the power and the strength to heal anything. And so the way we use it is, for one thing, that the practitioner is loving whatever the issues are at the present time with the client. And at the same time, we're trying to bring the client to a place of unconditional lovingness of whatever the problem is. And so the major techniques we use for that is, of course, forgiveness, but also compassion, mercy, and understanding, among other things. And in this case, we're looking into that aspect of working with the superego, which is the part that judges oneself, that evaluates oneself and one's activities. And so we are now facilitating the letting go-ness of a part of that inner charge that judges oneself. And we're kind of intending to shift it from its current position to more of a place where it can use understanding and wisdom. Okay, while this is working, while this is shifting, I want to talk a little bit about the steps of love therapy here really quick. And so the idea is, the first step is that we're creating a container, so to speak, that is strong enough to handle anything that is there. And depending on where the client is in their own inner process, that would include working with ethics and morality, character development. It would mean to learn to be able to feel one's emotions, and in general to be more accepting and able to process whatever there might be in the subconscious. The next step, which was part of what we worked on today here, is working with judgment and forgiveness. Then the third step would be working with the superego. And that's really the essence of what came up at the end of this formula, where we're helping to shift the superego from its position that it was to being more understanding. So it becomes more of an unconditional loving teacher. After that, we would work with guilt and other self-punitive mechanisms that are going on within the psyche. And after that, we would move to what we call unconditional self-forgiveness. And in this step, we would literally practice to forgive everything about oneself, which would then lead to the final step of unconditional lovingness towards all the problems, all the issues that are going on within, and then, of course, also without. The next thing we're going to look into is the flow of the Kundalini energy, the abdomen area. And so we're going to improve the circulation of what's called Kundalini energy in the abdomen area. We're using for that a Parama Bodytalk technique that's called circulation plugin. But all that it means is it really helps to improve circulation. I'm gonna give it a moment to integrate. Next, I'm drawn to the Chinese 5 elements, and we're gonna balance an aspect of the thalamus with those 5 elements. We're gonna focus especially on the processing function of the thalamus. And to be completely precise, we're looking into the midline nuclei of the thalamus that we're balancing with this Chinese medicine technique. I'm getting that there's a genetic factor that impact the function of this particular nuclei in the thalamus, and we're helping to resolve the genetic factor passed down from the mother's side. Okay, that's all that the client's body wants to integrate right now. And at the end of a session, I'm asking if there's any homework. And in his case, the homework will be a body talk technique. It's called the chorus technique. And the client is asked to tap out his choruses twice a day, one time in the morning and one time in the evening. And this will help to integrate all the different work that we did as far as the brain was concerned. The other aspect is that after what we did today, it will take about 4 weeks or so to integrate those things. And then normally another follow-up session will be helpful. So how are you doing over there?
Really, really good. Yeah. Yeah, there was I could feel like a lot of tension, especially in my lower body and like in my like core, just being released. It was really great listening to the session too, because seeing like what I've learned and like where it can go, it's phenomenal, like the depth it has to it. Yeah, it was really incredible. Like even whenever you were doing the session just now, like I could feel whenever we started the conversation, like there was some clarity, but then like the room opened up whenever we got into the point. It was like, here's the session, you know?
Mm.
It was like the energy in the room like really opened up, lots and lots of peace. And just as the session went on, it was like I kind of drifted more into peace.